Dan Weissman, welcome to Jewish Money Matters. How are you? It's so great to have you on the show.
Thank you so much. I'm great. It's great to meet you.
I was just chatting with you that I would spend the day in your hometown of Chicago, where I hopefully will spend a lot more time in the coming years. Great city. We had a great time, my daughter and I, exploring high school. So Dan, let's get to your show. You're the host of an awesome podcast, An Arm and a Leg. I love the name. It's all about why healthcare costs so much and what we can maybe do about it. And it's Dan, it's informative and it's entertaining and it really is empowering. I'm becoming kind of an arm and a leg junkie.
Oh, thank you. I'm so happy to hear that. How did you hear about the show?
I actually heard about it through Farnoosh.
Oh, yeah.
Yes.
Great.
Yes. Great. That's how I found out about it. So before we get to the topic of an arm and a leg, healthcare in America, I have to ask you then, was there, why a podcast about healthcare? Because I know you have, beyond the fact that you have an impressive career as a reporter, was there some sort of personal impetus for this?
Yes. Yeah. I mean, there was, and it's also a topic I had kind of been pitching for a long chunk of my professional life. Because as a reporter and as a person, you just can't help running into it, right? I mean, the reason you show is this is a problem that affects all of us. And, if you're lucky, it's something you might have some anxiety about, or occasionally like, I'm being charged $300 for this. Like, why? But, for many people, being charged an extra few $100 for something is like, that would have been a big chunk of your rent. This would have been, and again, like to run into a bump that's a few $100s is getting off very lightly. That people, get bills and people end up with charges that, consume more income than they might have in years. And, as a reporter, as a person, or have near brushes with it, right? As a reporter, as a person, you run into those stories all the time. And so I've been pitching to places I'd worked, like at Marketplace, at WBEZ in Chicago, to editors like, hey, I think we could do a service here. Like, this is something, this is an underwitnessed, problem. And it's something that we don't talk about enough from a just like, how do I deal with it perspective, and kind of why is this happening perspective. And the editors were all like, well, it's an interesting idea. Everybody here has an interesting idea they'd like to do. Well, if we want to do yours, which is that's how it goes. So again, when you have a job, that's how it goes. And then, I left a job and I was like, well, wow, what am I going to do now? Partly because I live in Chicago, which is a great place to live, but there's a limited number of places to do what I most love to do, be a reporter here, especially for radio. And so I was like, well, I don't know. I'm not going to move. And I definitely want like a job that comes with health insurance because, that's important for all kinds of, I can tell you my story, but everybody has one. And so I was like, I guess I need another career, which I was really, really unhappy about. And, we were lucky. I had a few months, kind of between our family's resources and my wife's forbearance,
right.
We were able to say like, okay, take a few months, Dan, get your head together, before you even chart the course for whatever the next thing is. And I kind of reconciled myself to when someone at a Hanukkah party was like, you think you might not be a reporter, but you really like that. Isn't there anything you'd want to do? And I was like, well, there is this story I've been pitching for a long time. And, I was supposed to New Year's, January 1st, 2018, like start like the actual hunt for whatever was next. And I asked my wife, I was like, what if I took a week and just talked to people to get some sense of whether this could be a prospect, a thing that I could do? And she was like, okay. And that week was very interesting and very fruitful, and turned into 2 weeks and a month and 2 months. And, at the end of a month or two, I was making prototypes and I'd come up with a name for the show and was starting to kind of figure out how it could work. But the main thing that happened in those 2 weeks was I would tell people I was thinking about doing this kind of thing. And everybody that I talked to, people who were just, another dad on the playground, or my friend who's a real estate developer who had, has a head for business, a friend who was the host of a very successful show. I would talk to them about, well, I'm thinking of doing this. What do you think? And, they had various opinions about whether this was a smart idea. but they were all like, oh, well, yeah, did I tell you about this thing that happened to me? And all of the stories were hair raising.
Yep.
And I was like, I think the audience for this show might be bigger than I thought. So that's the personal, that maybe I have a long story, but that's the personal story of how I came to do this.
So wait, but what happened with the healthcare question?
Oh, with my healthcare question?
Yeah, because one of the things that was holding you back was that you needed health insurance. So were we relying now on your wife's health insurance? Is that what ended up happening?
Well, she's a solo entrepreneur, so it had been my job for years to have the kind of job that came with health insurance.
Okay.
And so we decided to kind of give it a year that we, through Cobra, which is where you leave a job and you can kind of pay the whole thing for health insurance from that job for a year and a half. And we figured that would see us through 2018. And we figured by the end of 2018, we would have to have a new answer of some kind. And so what happened was, she ended up kind of expanding the way her business was organized so that it was employing her and one other person. So then we were able to apply for group health insurance. I mean, we looked at Obamacare plans, and I mean, it's a whole story. Like the first episode of our show has tape of me like tap, 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 tap. What is this? How does it work? Because my personal story is I have a congenital heart defect and I'm able to live my life, but every year I go get checked out.
Okay.
And so I looked at, I looked back at our records. And I was like, well, what does that cost? I know what I've paid, but like, what does it cost? And, the sticker price on, it's like I get a couple of tests and I see a doctor.
Right.
And we talk about the test results. And the sticker price on those tests and that doctor visit were more than $10,000.
Oh my goodness.
Yeah. And I was like, well, is any of that covered under any of the plans on the Obamacare exchange? The answer was no.
No.
None of again, like not only a few places. I get seen, a place that has like a specialty clinic for people with congenital heart defects.
Right.
Probably where I should be seen. I shouldn't probably like go someplace else for it. I was like, are they covered? The answer was no. I was like, well, my education in all of this was like has been ongoing. I was like, well, so under Obamacare, isn't there this thing where there's like an out-of-pocket max, and that's as much as you'll end up paying? I mean, like, okay, maybe it's $10,000, but like, what if we budgeted $10,000? Like, what if we did that? And so then I was like, well, does that out-of-pocket max, I should check this out, apply to out-of-network things? Like if it's not actually covered. And the answer was no, not covered. Doesn't apply. And I was like, there's tape of me just like seeing this and be like, I think that means we are effed. Like that was just like it. I was like, whew. So we quickly pivoted, and Devora reorganized her business and took on made somebody who'd been a contractor an employee with their like thumbs up, and suddenly we made sure that Blue Cross agreed that her business really did work this way, and they did, and so we have insurance through that.
This story is so relevant because we are in this time of the great reshuffling, the great resignation, and it's one of the big things that holds people back from pursuing something that they love, that is really aligned with their values. Is this sticking point, this health insurance? I remember we had a very similar story. I think it was either 2018 or 2019. My husband really wanted to go on his own. He really wanted to leave his job. I'm a freelancer. I have online courses. I have this, I have that. We were relying on his healthcare insurance, his health insurance. Let me tell you, Dan, the amount of hours we spent in trying to navigate this, it was insane. I think there were spreadsheets involved.
Yeah, of course there were. Yeah, of course.
And then at some point, we just said, we're going with this one and we're going to pray for the best. And we really had to spend time studying it because, I mean, we were getting pitched these things that I was like, Matt, this won't cover the doctors that I rely on and that I rely on for my children. Like it was complicated.
Oh, yeah.
And so, I don't know that is there what else is one to do here?
It's one of the worst things, right? Like just recently, a week or two ago, I guess, the feds came out with some very detailed, arcane guidelines regulating about health insurance regulation.
Okay.
And, a nerd that I follow, who does this for a living was
You mean a fellow nerd?
Right, a fellow nerd. I mean, but she's like a super nerd about this, right? He's professionally a nerd about health insurance regulation. And she was like, hey, this just came out. And she had a whole little thread like, well, this and this and this, and I responded like, I take a little bit of nerdy pride in being able to say, like, after a few years of learning about this, I understand about half of what you're tweeting here, but it like completely sucks that really all of us would need to be able to fully understand it just in order to be able to answer basic questions of like, what does my insurance actually cover? And am I being screwed here? Is it illegal what you're trying to do to me? Because I don't, because like the people at the insurance companies, like when you're evaluating, a health insurance plan, you're evaluating a financial instrument.
Right.
That's I would say is exactly as complex as like a derivatives contract. And that has been designed by an equally expensive team of lawyers and economists and actuaries. And all that sophistication is on their end.
Right.
And you're just you, right? And, in the kind of what we think of as the financial world.
Right.
Like, do you remember the movie, did you ever see the movie The Big Short?
Yes.
About how the financial, and so you might remember, because we rewatched it recently, because my son was asking, the topic of 2008 came up, and he was like, what happened in 2008? And we're like, let's watch this movie. And so we watched it recently, and there's a scene where there's these two young guys who, they have they've got a little financial company operating out of their garage in Colorado, and they want access to the financial markets, and they go to New York and they meet with somebody, but they don't get the meeting. Like the person they're supposed to meet with sends his assistant down to the lobby to say like, yeah, in order to play in this casino that we operate, you need to have, this many gazillions of dollars up front. And they're like, yeah, that's, several zeros more than we have. They're like, that makes us look kind of stupid, right? He's like, it's not great. Yeah. But like, there are rules that prevent ordinary people from having to enter that kind of casino.
Yeah.
When you're, it's just for play, basically. But when it's our actual just lives online,
it's our lives.
We're expected to just walk in and just like pick something off the menu and hope that we'll be okay.
Yeah, on so many levels, it's worse than the financial services industry, right? Because the financial services industry also is notorious for making it super fancy and complex so that you don't know what you're getting yourself into. We know all the stuff, right?
Yeah.
But this is that. Plus, it's not just your money; it's your money and your life.
Yeah.
It's really and going back to the initial idea of your show, and you asking people and noticing everybody has a nightmare healthcare story, and I feel like, Dan, if you don't yet, it's like you just wait, right? We're all waiting for the shoe to drop.
Yeah. No, it's a terror.
Is there any hope? I mean, when the shoe does drop and you get that ridiculous bill, or short of filing for bankruptcy, what can we be doing? What are some best practices that you've learned over the years?
So a couple of things, right? One is, sadly, we're not going to win them all. Like, there's things that we don't have answers for, but things are so complex. There are kind of ways forward sometimes. And the people that I've ended up, making a bit of a specialty and kind of talking to people who have found their way and have found a way to help others. And I appreciate you asking, and I'm like, I should have a pat answer for this. And so let me and it should be like part of the story of the show. So let me wing it here. So there's a woman named Lori Todd who had a very, very daunting cancer diagnosis. And she learned, and her doctor was like, look, man, I'm sorry. And she found it within herself. And she had a bit of, I think, pride in being like smart and indomitable, even though she had been, her professional life had not kind of called upon her full capacity up to that point, in that sense. But she was like, this is it, life or death, we're doing this. And she got herself very familiar. She learned to read the medical literature about her particular cancer. And she found that there was an effective treatment. There were a very limited number of people who specialized in it. And she went back to the doctor, and the doctor was like, nah, and maybe this is what had sent her off to the library to really learn. He said, because the first thing he said, I think this is before she did the research, he said, there's no treatment for what you've got. And if there were, they wouldn't pay for it. And she was like, challenge accepted, basically. And she was like, no one's going to tell me they're smarter than me and get away with it. No one's going to dismiss me like that. That was her. And so that was her way. And so she literally found there was this thing. She identified that the doctor who could do it, who was the best doctor at it, and she found out how to tell her insurance company, like, this exists. You on paper have an obligation to pay for care that can't be given in your network that is life-saving. She said, but that's not trivial. I mean, to say the least. She basically said, I went to the library and read through a shelf of insurance law and contract law.
Wow.
And she was like, and then she learned how to kind of hack the bureaucracy to find, like, well, who are the decision makers here? Who makes $1 million decision for this company? And how do I get to them? And she, essentially became an extremely effective lawyer on her own behalf, because one of the problems is, right, like whether your insurance company is telling you no, they won't pay for this thing, or someone's telling you that you have to pay for something that you don't think is right. Well, what lawyer is going to take on that case? If you don't have enough money to pay the medical bill, you don't have money to pay the lawyer. Right. And if there's no damages for them to take a chunk of, then what's in it for them? And so she basically became, her own super lawyer. And very, very quickly, because she was on the clock, like, got it done, got it reversed, got the okay. And after she recovered, as she was recovering, she got a note from somebody, because she was on, there's message boards for any disease you might have.
Right.
And it's a tighter knit community for less common diseases. And someone was like, hey, I've heard a lot about your success on this message board. Do you think I'm in the same boat? Could you help me? And she was like, what do we got to lose? Okay. And she did it for him. Wow. And she's now done this. That was almost 30 years ago. She's now done this maybe almost 20 years ago. And she's now done this hundreds of times for other people. Wow. And she's learned even more about how all this works. But like, it shouldn't require, like, that's the maximalist case. She was in the worst possible position. She was going to die if she didn't get this specific care, and she couldn't pay for it herself. And as she put it, she was, her insurance was crap. She was with some rinky-dink HMO that mostly was in business to not pay for things. And she made it work. So the answer there is, like, almost anything is possible if, right? Although I suppose there's a world in which, like, she lost, which she didn't manage, but she's, she had the disposition, right, the self-belief, and the skills that she was ready to put to work, to do that. So I find that, like, I'm a little sad relating that story to you, right? Because
that's the extreme case, but most people can't do that.
You shouldn't have to have superhuman reserves,
right,
of will and kind of the right flavor of intelligence,
right,
and determination to like not be made a fool of, which he said, like, I wasn't gonna let these people make a fool of me. Like that wasn't acceptable. I'm not gonna lay down and take it. You know, you should not have to be that kind of person. And you should not have to, I mean, she's helped hundreds of people, but like, it's obvious there's more than hundreds of people who need that kind of help. You shouldn't have to have that kind of resource. It's a totally horrible system. You know, there've been, and it doesn't always, I mean, not everything requires that level.
Right.
You know, the thing that makes me most hopeful is very early on in the show, like when I was still developing the idea, one of the first stories that came out, a friend of mine who's been a performer at Renaissance fairs for decades. And I mentioned I was doing this, was like, oh yeah, we have this thing, Rescue, where it's a very homemade thing where the people who work at Renaissance fairs, like just have little fundraisers for each other and over to kind of pay to these medical bills. Because, you know, they're itinerant, a lot of them don't have hardly any money. And they would just like have little fundraisers for each other. And it grew into a thing where they now raise significant amounts of money, you know, every year. But what really is the magic is that, you know, if they've raised, when I did the story, they'd raised maybe over the course of more than a decade, like $500,000 to pay each other's medical bills. But
wow,
they had made more than $1 million, I mean, total almost $2 million of medical bills go away.
Wait, how?
By negotiating, by advocating. You know, many, and so they had found kind of, there's all kinds of things. I mean, one, nonprofit hospitals are required to have financial assistance policies. If you make under a certain amount of money, they forgive some or all of your bill. And honestly, you know, you can negotiate a bill. Like, look, you're telling me I don't have insurance. You're telling me I'm supposed to pay $10,000 for these tests. You and I know that you would take $2,000 from Blue Cross, and I'm going to tell you now, you're never going to get $10,000 from me.
Right.
What if I give you $2,000? Can we call it square? That requires, you know, doing that successfully also requires moxie and requires understanding the system. It requires know-how. These are not things that most of us are great at doing on our own behalf.
Right.
Right. But they had like a half-time person who was great at it, right? Who'd been doing it for a long time, who would kind of come up through this whole system, who'd been mentored by one of the people. And it's like, as a half-time person, she was making all this money disappear. And I said at the end, when we put that as an episode, I was like, look, if you know this kind of person, or if you are this kind of person, please get in touch.
Yeah.
And somebody I know, somebody who was a neighbor of mine who I'd met once on the schoolyard, got in touch and was like, I'm that person.
Are you serious?
Yeah. She's a type 1 diabetic, had been diagnosed at age 12. Her dad was a doctor. Her mom was also in healthcare, grew up in a small town. And she really understood how things worked. Both because she had that kind of indomitability and because she had some back-end understanding. She knew that her dad had given away lots of free care. A small town doctor. She knew that people, and she learned it all, you know, kind of like on the job.
Yeah.
As a type 1 diabetic who didn't have regular insurance for a long time, didn't have much income. And she knew all the tricks. And she would hang out on Reddit boards, dispensing wisdom, you know, which was great. And I was like, this is good, but how do we organize this? So it turns out, thank goodness, because it's not, I was like, so I said at the end of that season, I was like, we'd started to orient the show toward this idea of like self-defense. And I was like, so we've profiled someone I'm now calling a medical bill ninja. Like, can we start a dojo, like a training academy? And it turned out like I'm a reporter. It's not what I'm good at. Like organizing things is not my thing. It turns out, I mean, like never was. But so luckily, I mean, for all of us, there's the other kind of amazing story is in early 2021, I started getting tips from on Twitter and email to look at this TikTok that was going super viral.
Yeah.
This guy who looks like a kind of like, you know, hipster guy was like, look, here's a secret you won't hear. Hospitals are required to have financial assistance policies, nonprofit hospitals. And here's how and that they'll make your bill go away. And like, you can hold them to this. It's a legal requirement. And in this 60-second clip, he demonstrates like type into Google the name of your hospital and financial assistance. and like, you should get the policy, and you're just scanning it for the income kind of, there should be something like a chart that shows like what your income could be and how much of their bill they'll wait. And then there should be a link somewhere. It should be instructions about how to apply, and you just do it. And he's like, and if you're not sure you can do it, hit me up. I do this. He was running a tiny nonprofit in Portland, Oregon, and did this for people locally. And, you know, that video very, very quickly, like in a few days, got like, you know, was seen 10 million times.
Wow.
And he was overwhelmed, right, with requests for help.
Right.
That was almost a year and a half ago. And the most incredible thing, I mean, he's an extraordinary person. His name is Jared Walker. The group he runs is called $4. And he got a lot of offers of people to help. And he is the kind of person who organizes things, and he was able to say yes. And so within 6 months, those people had, you know, working with him, like, organized a database that included the financial assistance policy for thousands of hospitals nationwide, everything that they could find, which in some cases was on the website. In some cases, they had to make a lot of phone calls, and they had crunched that into a database and then built a website around it. So you could, which is what, you know, they kind of scaled up what he had going in Portland, Oregon, which he had built, you know, for local hospitals, where you could say, like, I went to this hospital, my bill is this much, this is my income. And it would tell you, like, you're probably eligible for financial assistance. Do you want us to help you?
Wow.
Since then, like, once he did that, he opened up the next door and started offering to train people to negotiate on behalf of others. Because sometimes you just have to fill in a form, and sometimes it requires a little elbow grease and know-how. And so he started hosting like monthly trainings on Zoom for anybody who wanted to learn the tricks.
That's awesome.
And advanced trainings. And again, with the help of those early volunteers, created like a ticketing system and runs it like a help desk, so that, you know, requests come in and somebody grabs it and, you know, works the case. And there's a kind of hierarchy of people who, like, with more experience, who you can turn to for help if you run into problems, including at the top of it, Jared. And people work the cases, and they have an open Slack channel where every day it populates with, like, I just got a $2,000 bill result. I just got a $30,000 bill result. I just saved somebody $500.
That's amazing what he's built. I'm so impressed.
It's the best. I mean, it's incredible. It's great. It goes farther. So I talked with him just a couple of weeks ago.
Yeah.
And now this incredible backlog of requests for help, they're caught up. Okay. They've also continued to kind of refine the website. So, you know, it said, like, do you want us to help you? Or do you want to do it on your own? You know, here, here's some instructions. The instructions are great. And he says he hears from people all the time who are like, I did this, it worked, thanks. And the next thing he aims to do is to take this next step, which again mirrors exactly what the Renaissance Fair workers were doing. They, you know, because not everybody qualifies for financial assistance. There's an upper income limit, right? But just because you don't
qualify doesn't mean you can pay the bill.
Right, exactly. And so this is where the negotiation part comes in. And so he's aiming to kind of train a cadre of people to do that negotiating. I mean, I was never going to do this. I'm a reporter. Like, I don't, like, just filing stories and like trying to run a little podcast is like, you know, as much organizational moxie as I have in me. It's so moving to me.
I love this story. It is indeed so moving. And it just shows such a positive side to this huge challenge that we're all facing. Like, talk about turning darkness into light. Oh my goodness. Now I want to go back to, you mentioned your neighbor and how she got into this. She was a daughter of a doctor. She knew like the ins, especially seeing her father who had so many times given, you know, treatment. And I remember also my late, not my father, my stepfather. He was a surgeon. I just remember growing up, he also tons of things that he gave to people for free. It was just, this was the way it was. When I go to the doctor today, Dan, there is such a stark contrast between those days growing up and those personal relationships where it's almost like you could have that financial conversation with your doctor where you could say, okay, I get how much this costs. Could we work something out? Could this treatment be maybe spread over time? So that my insurance could, I don't have to use my whole deductible. Like, there was a space, there was a relationship. I don't know that we get that anymore. I mean, it's like a conveyor belt. You show up in these fancy offices and you see your doctor. They don't tell you what anything's going to cost. Then you move to a desk where they tell you. And this person has zero authority. If you're lucky, they'll explain to you how this is broken down. If you're lucky, most of the time they have zero authority to have a negotiating a conversation, to even understand and even try to work a plan out. This is even before you get to the part of getting slapped with a medical bill you don't understand, and then you have to negotiate with, this is just from the get-go. It's just changed so much.
Yes. Yeah. Yeah. There's a ton of gatekeeping, right, between you
right.
and the doctor. That to like limit the amount of access you have to that doctor just to like get healthcare from them.
Right.
And then let alone have any kind of conversation about the financial relation, what means to you larger in life, and any access you might have to somebody who has any knowledge or authority. Also, there's just a ton of gatekeeping between you and those people. No, you're absolutely right. Yeah, it's terrible. I mean, I've been learning, right? And Jared is becoming more and more expert at, like, there are ways, right? But it just takes, it takes the kind of persistence that most of us frankly don't have time for.
Yeah.
And you want somebody, I think what's brilliant about what Jared is doing, what the Renaissance Fair folks have done, it's like having access to somebody, having somebody who's your ally in that, who's been there before.
Yes.
Right? Because it's also true that, like, I'm just trying to live my life. And by the way, I'm sick. Like, I'm not really at my peak, and managing
a job and children and life.
Right. I had a to-do list before.
Yes.
And that's also like piling up on me while I'm sick. Like, how am I supposed to like become an expert at this? No, it sucks. And, I think it sucks that there's like the darkness and the light, and there's also like the darkness in the light, right? Like, it's horrible that there's any need, one, for someone like Jared to do the things that he does. And the prospect, him scaling up what he does to kind of solve our whole problem. I mean, let's see how far it goes. But it also seems like the scale of what we're talking about, this didn't happen overnight, and it didn't happen by accident. Where we are is the result of a lot of people over a long time coming to understand that there's just a lot of money to be made in a business where the value proposition is your money or your life. As those people got more skillful and more knowledgeable, and the other piece of it is they are in competition with each other. That, if you're a hospital or a doctor's office, you are negotiating for payment with an insurance company and with the federal government, right? With Medicare and Medicaid, both of which are, who are on the insurance company side. I mean, they're trying to like minimize what they have to pay you, any way they can. Right. They're going to nickel and dime you for anything that they pay for, and they're going to want to deny care. And so you have to invest in fighting them and invest all these resources in making sure that you get paid, that you're going to get paid for whatever you do. Right. And that if they nickel and dime you over here, you're going to make it up over there. The government is here kind of wanting to police you to make sure, like, look, you can't not give this care, and you have to, meet these standards. And like, sometimes they're responding to the contortions that you've already had to do to meet the challenge over here from the insurance people. it's, and when you get into medicine, it's, now you've got more. You've got the pharmaceutical company over here, the insurance company over here, and you've got this whole class of players called pharmacy benefit managers, which are kind of middle people between the pharma company and the insurance company and the drugstore and you. And their whole deal is making a profit by being a middle person entity between all of them. And they, again, all of it means it's all a bunch of sharks, basically. It becomes a bunch of sharks, fighting each other over who's going to get to take the biggest bite out of you, because ultimately we're paying for all of
it. You after hearing you, I'm thinking, why would anybody want to become a doctor nowadays? Between the cost of student loans and you're going to have to become a shrewd businessman, you won't really be practicing health.
or you'll be working for shrewd business people.
Yes.
Right.
I just heard your latest episode about the private equity business getting involved in healthcare. I was like, wait, what?
Oh yeah.
Tell us a little bit about that. That was like, whoa.
Yeah. So private equity, the folks who are the barbarians at the gate, kind of buying and selling companies. They want to make as much money as possible, as quickly as possible, have seen, real value in this business.
There's money to be made. It's a business.
The money of your life. You've got a captive audience. And so the big first kind of area was in emergency medicine, where literally employing ER doctors, because ER doctors aren't generally employees of the hospital. If you're running a hospital emergency room, most things that happen in a hospital are fairly predictable. An emergency room is not. Right. And you have to have it staffed 24/7. It's like running a 24-hour diner, right? And if the fry guy doesn't show up, you got to have somebody who's going to fill in. And this is true for everybody in that ER. So with doctors, over time, what emerged were what are called ER staffing companies, where it's I'm going to take care of that for you. I'm going to make sure there's always a doctor showing up for the shift. And you're not going to have to worry about that. And we're going to send our own bill, right? Whatever. And so some time ago, private equity companies got wind, you send your own bill. The doctors work for you. We think if we got into that business and decided not to take insurance, who's going to tell us no? I mean, you're in the emergency room. You didn't make an appointment with me. You didn't choose me as your doctor. I'm here. You're not going to walk out, and no one's going to tell you what the bill's going to be when you walk in. So they kind of, if they didn't invent, they definitely kind of made a business model of what are now called surprise bills. You get treated at a hospital that takes your insurance, and then surprise, you get a great big separate bill from the doctor who doesn't take your insurance. You're on the hook for whatever. This has recently been outlawed by the federal government. This practice of sending a bill that's by saying basically that doctor and your insurance company have to work it out. And you're just going to pay whatever you would have paid if it was covered, if they were on your insurance, and you don't have to worry about the rest. Okay. But, that law got made because this became a giant problem that all of us were aware of, or, enough people were hit by that every member of Congress was being yelled at by constituents, can you please solve this? So they got a taste, though. It was very, very lucrative. And they're what else could we do? Where else might be places where this would work? And they decided that they've kind of figured out and been investing in areas where there's a lot of procedures. Where people, again, don't always, you got to see your dermatologist if you want to, make sure you don't have skin cancer. And if they're we're going to cut that thing off, you're going to get it cut off. Right. So they were great. What if we owned those practices? What if we owned all of those things? So dermatology is one. And the one where we ended up learning about it was gastroenterology. We got an email from a listener who was I just moved to a new town, and the bill for this, and I have Crohn's disease, so I got to get a lot of things done. And I'm supposed to get a colonoscopy, and the bill is going to be 3 times what I'm used to. What's up with that? And the same practice seems to run everything in my town. And our producer, Emily Pisacreta, did a little digging, just did a little Googling, and found that those practices were all connected. And in fact, they were all owned by a statewide entity, which in turn was owned by a national entity, which was owned by a private equity firm. And she called around and found that, yeah, a few years ago, an investor kind of wrote a blog post saying, like, we're in the golden age of older rectums. Is grim and hilarious and awful. And it's just like, look, everyone's supposed to get a colonoscopy once they're past a certain age, like pretty often. There's a lot of money there. Let's corner that market.
Wow. So these private equity firms are coming in, offering medical practices to buy them.
Yeah.
And then they in part they're in the business of making margins, right?
Right. Yeah. Maximizing profit. Yeah.
Maximizing profit. So then you're just going there for healthcare, and all of a sudden you're getting hit with who knows what, because that office has to run at the most profitable level.
Exactly. Yeah. Yes. Yeah.
It's so crazy. And again, it makes me wonder, why is anybody going into medicine?
I mean, I hear from doctors a lot. You know, there's a term among practitioners, doctors, nurses, called moral injury, which is, you know, when you went into being, you know, to the thing, because everybody needs a job.
Yeah.
And you want to align, if you can, you want to align that job with other things that you want, including to like be a healer and to make a decent living. And you know, what the reality that a lot of people find is that they are, you know, they're the things that they end up having to do as part of their jobs don't feel right. You know, that they're involved in kind of denying care or being unable to help people because of the structure in which they work. And this is when people talk about, you know, we've heard a lot in the last couple of years, especially through the pandemic, about burnout among healthcare workers.
Yeah.
And one piece of that conversation among healthcare workers is this problem of moral injury. You know,
it's crazy.
Yeah.
It's so crazy. You know, we talk about Jared and we talk about the power community. My husband and I had to navigate, so someone in my family needs to get these autoimmune suppressants for a skin condition. Talk about dermatology, which is not really a skin condition. It's an autoimmune condition, you know, the gist, right? Yeah. So I'm in these chat rooms, these boards of mothers with, you know what I mean? And so you learn a lot. And it turns out to be that I have a close friend who since she's a child, she's been getting these injections. So she told me, you know, if you or Matt want to talk about this, I know how to negotiate, because this injection that they're saying your child needs to get is going to be very expensive. Yeah. Every shot is $11,000 and they need it every 3 months. And it's not necessarily covered by insurance, but there's a loophole where you can apply. And I'm not sure if it's with this pharmacy benefit managers that you mentioned, but there is something, because my husband takes care of it. So she walked him through how to do that. And there's this whole application process. And so for the good news is for the first 2 months, it worked beautifully. And they sent us the medication. I think we had to pay like $5 for an $11,000 thing. And it all worked fine. But every time you have to apply.
Right.
So by the third month, the third shot, we had an appointment with the doctor to go so the child could get the shot. And they denied it. And so I don't have the details of the story of what was the negotiation here. Maybe you want to talk to Matt. But he didn't want to stress me with it. And so finally he tried. They said no. But would you believe that talking about having a relationship, it turns out that I guess he had been in touch with the doctor throughout the process. Yeah. And at some point, my husband said, well, it turns out that we didn't get approved for the medication, so we won't be coming in. And she said, oh, don't worry, I have a sample in the office. Just bring him in. Right. Now, what is this miracle? I mean, that was just like, it was a miracle. That's all I can say. Right.
Like it. Yeah.
But it does speak to get help from people who navigate the system, who've done it before. Yes. Right. Yes. There is a community out there of people who are willing to help. And as much as you can, try to have some type of relationship with the doctor and be in touch try to somehow build that email connection or someone, at least for maybe it's not the doctor themselves, but it could go a long way.
Yeah, I think that's right. I mean, I think you're searching for a human. I think putting yourself making yourself available in a real way,
right,
and kind of assuming the best of the people that you talk to,
right,
kind of showing people your human side, because we absolutely have it. It produces in me, and I think in lots of us, exposure to this system, and encourages a kind of defensive and angry crouch.
right.
And the truth is and I thank you so much for saying this, like that, keeping ourselves in a place where we can be our real,
Yeah.
authentic selves,
Vulnerable
to an extent.
Yeah.
And I think the like one of the most interesting episodes we've ever done was, we've been talking about self-defense for a year, and I was like, I'd like to talk to a self-defense instructor.
Okay.
And there's a whole kind of school of self-defense that's kind of primarily pioneered by women practitioners, and is often kind of taught by and for people who identify as women, called empowerment self-defense, which has to do with not just learning to kind of kick and punch, but also, and more broadly, to kind of defend against all kinds of encroachment, harassment, right? How to basically stand up for yourself, how to enforce your boundaries. And, in order to do that, you need to learn to center yourself, and ground yourself, and believe about yourself that understand about yourself, that you're worth defending. You have to kind of be in touch with that part of yourself. And there's also tricks, right, in the interpersonal stuff, where this woman the person I talked to, relayed a whole story of her own, where she was appealing something, and she called, this kind of state watchdog who was supposed to help. And the first thing the person said to her was, she said, I need to learn about how to file an appeal. And the first thing the person said to her was, well, I'm sure you missed a deadline. And, and our hackles go up. We're like, no, I didn't. Or what, right. Or, oh my God, I did. And she's like, so what you need to do is, as she's put it, stay on your agenda, to not get hooked into that kind of interpersonal stuff and not respond to the harassment, essentially, or the provocation. And her response was, so what I said is, I need to learn how to file an appeal. And by sticking to her agenda, and by, not reacting, right, she, over time, ended up with a very productive relationship with that person. She ended up getting messages from that person like, hey, we're really making progress here.
Wow.
Right. So that process of forming allies isn't necessarily, I think, when we say being vulnerable, I think there's a tendency to think about, like, do we have to abase ourselves? Do we have to throw ourselves on someone else's mercy? And I think again, I find this quite moving, that process of learning to value ourselves, of, our own, reminding ourselves of our own, right to exist in the world as much as anybody else, and be able to speak out of that. It's a thing that we need in so many areas of our lives.
Yeah, we do. And I love that. I love that reminder for listeners. It's so true. Just center ourselves on your worth, what you want to achieve, that there's a human on the other line, but that your needs are also important, right? Stay poised and calm, get your point across, right? Don't take things personal. You don't know what the other person on the other side is going through, right? Just stick to the plan. And I think it's a great reminder, because we can become so despondent and so emotional. The whole thing is so stressful and so triggering.
Absolutely. Yeah.
Now, Dan, is the state of health, in your estimation, at this point, is the state of healthcare always going to be like this in this country? Like, is it always going to be one of these big pain points where everything's going to cost a fortune? And okay, of course we all need healthcare, but navigating this whole thing, and then these hidden fees and all the things we just discussed. From your point of view, what would need to get better? What would need to happen for things to get better?
It's such a good question, and I wish I had a satisfying answer for it. Because the powers that be, all the sharks, right? Among the investments they've learned how to make is investing in lobbying and campaign contributions, rigging the system in their favor,
Mm-hmm.
or kind of, lobbying hard, advocating for their interests. And because they are actually in a battle with each other, they're very good at saying, the pharma industry is very good at saying, it's not us, it's the insurance. Oh no, there's a shark over there. The insurance company is doing bad things, right? They're very good at pointing the finger at each other. It's very effective. So, I think of it as a problem, akin to, climate change, and akin to our whole, big problems in our political system, the influence, the way that people with money and power and entities with money and power have such outsized influence.
Mm-hmm.
I think that it's hard to see whole scale, sweeping change,
right,
without some broader realignment.
Mm-hmm.
However, the interesting thing is, I figured in doing this show and starting this show, like every episode was going to be evergreen. Like there was just like, none of this is going to go out of date, sadly. And I'll never run out of material. But, as it turns out, like, one of the big problems that we identified, that we, had, I'm such a genius, identified, like, was obvious and we got steered and we had to deal with eventually, was this problem of surprise bills. You go some places you think is covered by insurance, and surprise, you get a great big bill from somebody that you saw who secretly was not. And I was like, yeah, that's a giant one. Well, here we are 2 years later after we did, and like, that's actually against the law. And it took a long time, and the obstacles to it were ridiculous. And the solution in law is not perfect. And, there's still negotiation and pushback happening, but that episode of our show is now out of date.
Yes. Thank God.
So, yeah, right. Yeah. So it's not enough, right? It didn't solve all our problems, but even in what I would think of as relatively short time I've been doing this, this great big problem changed.
It's a major change. Exactly. Yeah. And from our end, as leaving listeners with on a positive note and with hope, we've talked about, building community. We've talked about researching, like there are people like Jared out there who have resources for you, right? There's your show with tons of tips, things happening all the time, where you can learn about people like Jared, where you can learn about other people in a similar situation. So building that community, finding those people out, negotiating, right? Knowing and negotiating from that place of worth. I think those are very, very empowering tips. Anything else that comes to mind?
My gosh, those are great. Thank you so much. This is like,
right?
What a great conversation. Thank you. I think that's a lot. It's a lot to absorb.
Yeah. And I love this because there is hope. There is hope out there, people. I mean, get health insurance, please. Everybody should have health insurance. I think that should have been tip number one.
Yeah, well, no, it's true. I mean, there's a big impetus, like a lot of us have an inclination, like, well, isn't there some alternative to having health insurance? And there are people who are ready to sell you some alternative to health insurance. And the problem with it is all those alternatives are worse. Yeah. I mean, it's not like you're not wrong to think like, why do I want to give my money to this insurance company that's in business to just take my money and not give me anything back? You're not wrong about that. That's a terrible position to be in. It's just that everybody who says they've got an alternative for you, you're putting yourself at even more risk. Yeah. So that's what we got. We got to get that health insurance and make the most of it. And we got to listen to your show. Thank you, Dan. We're going to tune in. Thank you for this fabulous conversation and for the work you're doing. The show is An Arm and a Leg. And is it by seasons? Is that how it works? We started doing it by seasons. We now do it all the time. We still label things as having seasons, and I got to figure that part out. But that's fantastic. Fantastic. And we can find you on Twitter, right? You're really active on Twitter. I'm on Twitter at Dan Weissman, 2 S's, 2 N's. The show's on Twitter at Arm and a Leg Show. You can find all of our episodes at armandalegshow.com. We're around. Awesome. Thank you so much for having me. It's been such a pleasure talking with you. Thank you so much, Dan.